Buenos días, tengan todos ustedes. Mi nombre es Grecia Turrubiates, coordinadora de este espacio junto con el doctor Oscar Valencia. En nombre de la Escuela de Medicina y Ciencias de la Salud del Tecnológico de Monterrey, les damos la más cordial bienvenida a esta sesión académica. On behalf of the School of Medicine and Health Sciences, Tecnológico de Monterrey, we give you the most warm welcome to our weekly grant rounds. El día de hoy tenemos nuestra última sesión del mes de noviembre y también del año. Today we have our last talk of November and also of the year. Y para darle la bienvenida a nuestro ponente del día de hoy, le cedo el micrófono al doctor Juan Francisco Lozano. Doctor.
Muy bien, muy buenos días. Good morning, Chas. Muchas gracias a todos por unirse. El día de hoy vamos a estar teniendo esta plática el día de hoy por el doctor, doctor en psicología, el doctor Charles Albright. Él es un psicólogo especialista en diversos problemas del neurodesarrollo y es profesor y catedrático de la faculty en la división de psiquiatría y comportamiento en Nationwide Children's Hospital en Columbus, Ohio. Es parte del staff del Fellow de Pediatría, el Desarrollo y Comportamiento. Tuve el gusto de que fuera uno de mis profesores ahí. I'm saying, Chas, I had the pleasure and honor of you being part of the staff and faculty when I was there at Nationwide. So it was great to have you there. Chaz, the floor is all yours. People are eager to learn a lot about this specific topic that it's frequent, but as pediatricians, probably we need to learn more on how to identify them. So please go ahead.
Yeah, no, thank you for that setup one, because I think that's exactly right and how I think of how we um, think about interfacing with learning disabilities while we are uh, working in a hospital setting. And so just to check, Juan, can you just verify everyone, are you hearing me okay still?
Yes, everything looks good and
Perfect. Just wanted to make sure before I get going because I can go on, and sometimes I'll not notice if no one can hear me. So again, thank you all for the opportunity. So again, I'm Chaz Albright. I'm a psychologist here at Nationwide Children's Hospital in Columbus, Ohio, in the Midwest of the United States. I wanted to talk a little more about learning disabilities and specific learning disabilities and how they interact with the children in our school environments, and how we as medical professionals can help identify and help advocate for children getting help in specific areas of learning. So my goal with this is to give us a brief overview and understanding of specific learning disabilities and think about some of the things we can kind of hear for, understand, and identify in our hospital settings, that when we hear those things, when we recognize some of those difficulties, when parents bring them up in some of our appointments, we can identify it and then hand it off to the schools, hand it off to any professionals in our system that may be focusing on learning advocacy and giving parents a better understanding of their child's learning and how they can help there. So I do want to give the caveat that the information that I'm sharing here is based mostly on research that was done in English and in the United States. I try to keep the principles universal, and most of these principles are pretty universal to the underlying cognitive skills that are involved in these learning abilities. But I wanted to highlight that specifically because, especially for talking about reading disabilities, I am not aware of any core differences that would be um, in reading in English versus Spanish or other languages for these specific skills. But we always want to be thoughtful, especially as we're kind of exchanging information across different languages to make sure that the underlying assumptions are still met. So let's talk a little bit about specific learning disabilities as an overview and get our conversation started. So The DSM, the Diagnostic Statistics Manual that we use here and based on the ICD that we use to identify specific learning disabilities. Identify specific learning disabilities as achievement on standardized tests in reading, math, written expression that falls significantly below what is expected of a person of their age, schooling, and level of intelligence. And so there's pieces across this that are important to kind of understand. And so when we're thinking of a specific learning disability, we're thinking about difficulties in learning skills in targeted areas. So this is not meant to consider children who have global learning disabilities like an intellectual disability or other difficulties in learning broadly, but that children are generally learning and developing skills well, but in these specific areas, whether that be in reading, math, or written expression, they're falling well below what we would expect given their general learning skills. And we generally look at that normatively based on age. We always want to consider the access to education that the child's had, because we want to think of a specific learning disability as something that isn't simply the result of not getting adequate academic instruction. So if we're thinking of a specific learning disability, adequate academic instruction is one of the things that we're making sure is occurring before we consider that, and as well as level of intelligence. And so we want a discrepant or a difference in the way that the child is learning in this specific skill as opposed to their general abilities. So a couple things to help qualify that just a little further, you see here down in the bottom notes, is that low achievement on one or more standardized tests that are at least 1.5 standard deviations below the mean. So a child who's performing significantly lower than we would expect, or on basis of clinical judgment, where you can use a more lenient threshold, more like 1 standard deviation, when we see other converging evidence from clinical assessment, academic history, school reports, and other test scores. So one of the things that we always want to think about with learning disabilities are that they come from many different places, and everyone kind of arrives at these difficulties in their own unique way, but that there are similarities between children who have specific learning disabilities that hold it together as its own specific type of learning disorder. So let's go on a little bit more. So 5 key takeaways from cognitive understandings of SLD. This idea of there being confidential difficulties in specific cognitive processes and not a global impairment of intellectual skills. And we talked about that a little bit more, that these specific weaknesses are not seen across the areas of cognition. This child is learning to complete activities of daily living well. They're learning how to get through a school day generally well. Oftentimes, other academic subjects are doing well. Math, right? Math is going well, but reading is having difficulties. These cognitive components, these delays that we're seeing in specific skills, are normally distributed in the general population. So when we're thinking about where these skills lie, we can compare them normatively to other kids because they're generally normally distributed, and we can generally get an understanding of where this specific skill is relative to other skills. Each academic and cognitive component may have a distinct brain and genetic signatures. There may be biomarkers that are at times able to be found that likely overlap because they're correlated, but they're not necessarily interchangeable. And this overlap in various SLDs at least partially accounts for their comorbidity. So there are specific brain delays that can predict at some level specific learning disabilities. And there are overlap between disabilities in reading and writing, especially, as well as in math. But the other part that goes with this, there isn't going to be a specific, I can see an fMRI that there's this problem in this part of the left temporal lobe, and so we now know that this child's going to have a reading disability. It's not quite that clean. And a lot of times we can kind of trick ourselves into this categorization where we can feel like we know exactly why these things are happening. And while we know components, I think it's really important to recognize that everyone comes about their difficulties with learning in different ways. And so while we want to look for the underlying similarities that predict learning difficulties, we also want to recognize and appreciate that everyone's going to have their own unique way of coming about the difficulties. And they're also going to need, while we have standardized tools to intervene with learning disabilities and standardized methodologies and procedures that work rather well, we also want to know that we need to individualize everyone's learning to make sure that we are accounting for the individual factors that each person has. And so the last point here I also want to highlight is that deficiencies in cognitive and academic processes, they tend to persist over the lifespan, and especially when there isn't intervention. So one of the things I often want to think of is we want to think about these academic skills as just that, skills. And skills are things that you get better at the more that you do them. And you get better at them when you learn them in a systematic, specific way where you get a lot of practice. And the more difficulty you have in learning a skill, the more systematic and the more repeated that practice needs to be to help speed up rates of learning and to help decrease those difficulties. But we wouldn't expect someone to have learning disabilities and reading all through childhood, and then kind of magically as they become an adult, they're just reading fluently and fine as well as anybody. That's not really the way these skills are developed. And if we want, and that's not saying that individuals can't get better at these skills as they get older, but there's going to be a requisite amount of work that goes into that and specific practice that goes into that, as well as a recognition, like all of us, as we get older, learning the rates become slower as we get older and as our brain matures. So a couple risk factors and prevalent things that we want to think about when we're thinking about specific learning disabilities. We know that there are some things that consistently make it more likely that someone has a specific learning disability. The risk factors include prematurity, very low birth rate, prenatal exposure to nicotine. We know that we tend to see specific learning disabilities more frequently in males than in females, from a 2-to-1 to 3-to-1 ratio. We know that there is some familiar risk of specific learning disabilities. So individuals are 4 to 8 times higher to have a child with a SLD, specifically, and especially in math. And there's a couple things we want to think of this, right? There is the genetic risk of that some of the cognitive factors have been passed down from one family member to another. There's also an environmental differences that. So if an individual struggles themselves with reading or with math, they're going to be more likely to be reticent, more likely to have concerns or hesitance to engage in teaching and practicing and reading together. And so that child may not get some of the practice in early childhood or the exposure in early childhood that they would otherwise. And so general prevalence of specific learning disabilities in schools, it tends to be somewhere between 5 and 15%. I think those ranges can generally be pretty wide and area specific. But in the United States, more recently, we've been getting studies looking more like 8 to 10%. But I think anywhere it's more helpful to look at some of those rates locally and regionally as much, I shouldn't say instead of, but as much as nationally or internationally. So a couple of predictors and things that we can be aware of and think about when we're thinking about the possibility of a specific learning disability. Some predictors that we can hear if we're in an appointment with a child, if we're doing a well check, if we have concerns about general development. Inattention in preschool, it tends to predict later difficulties. In reading and math, as well as inattention can be a particularly a factor that makes it more and more difficult to respond to effective academic interventions. Not that they won't, but that we have to think of a more individualized and more tailored response as opposed to like a kind of just typical rank and file academic intervention. So another predictor is speech and language disorder or impaired cognitive processing in preschool, especially in reading and written language LD. So when we obviously know that reading and writing is very closely related to language development. We'll talk about more and more some of the more specific details of learning in there. But when we have a language delay, especially in the first 5 years, one of the things we also want to be thinking about preparing parents for as they get to that school age is that language delays often lead to reading delays, even if we've remediated some of the language delays. If the rates of learning of language have been slower, they may also be slower when we're thinking about reading. Also, ADHD is also a predictor of specific learning disabilities. And we know when a child has ADHD and comorbid SLD, we can often predict worse outcomes. And so we don't want to use that knowledge to assume worse outcomes. We want to use that knowledge so that if we see SLD and ADHD, that we're specifically thinking as early as possible, how do we help this child? Because in general, the more help we can get, the more help we get as early as we can get is the best way to increase rates of learning and mitigate those outcomes that may be there. There's always a lot of concern in the world of learning disabilities that if we sort of identify some of these difficulties and assume they're going to be there, we have worse outcomes, versus if we see something as a risk factor and we're working to fight against that risk. That's, I think, the best way to get the best outcomes for individuals and not just assume that they're going to have challenges because we see some of these targeted difficulties. Others, like I said, 30% of children with learning disabilities have ADHD. It's the most common co-occurring disorder. Language development delays are often there, but also other specific cognitive difficulties. So motor delays, other kind of specific areas of difficulty there, perceptual reasoning delays, and also executive functioning deficits. So we'll talk a little more in a moment here about how specific learning disorders kind of build, but especially the farther along we get in any of these skills, the more we lean on things like attention, things like memory, and things like executive organizing and planning skills in order to effectively apply academic skills that that the children need to use. So other things that we tend to see compared to children who don't have learning disabilities, again, these are things that you may be hearing in an appointment that we want to think about, not just the things that parents are talking about in the moment, but also that there could be impacts on learning in school. We have more time sequence confusion, more difficulty in perceiving time and identifying times, as well as sequencing information and both verbally and visual spatially. More visual perceptual problems, more difficulty processing auditory and visual input. Again, there's going to be a comprehension component to reading, and people who have difficulty processing verbal information auditorily are going to have more likely to have difficulty processing verbal information through reading, as well as individuals who have difficulty effectively processing visual stimuli could have orthographic difficulties in recognizing words on a written page, and I'll have some orthographic difficulties that come out in writing as well. We know that individuals with learning disabilities have more social, emotional, and behavioral problems, especially in the school setting. So when you're hearing children, whenever there are behavioral concerns or social emotional concerns, when we hear that they're especially happening at school, and more so than at home, I'm not saying every time it's because there is a potential learning problem, but school is the place where the children have most demands placed on them. And parent and adults often can overestimate the demand that they're placing on a child. And if that's, in general, but specifically if a child happens to have a particular difficulty in learning in a specific area. So if they're generally very bright and doing very well, but they have trouble in reading or they have trouble in math, we may see more outburst behaviors, concerns in those areas. And that may be not just because they're being a difficult child in those areas, but also because that they're having task avoidant behaviors because they're challenging and the child doesn't know what to do and they may not be used to not knowing what to do. And so their responses are more extreme in those situations. We also see that children with specific learning disabilities have less overall neurological maturity. And so anytime we're seeing some of these medical signs, we want to think about the impacts those things may be having on learning. So a lot of what we talk about, especially in the hospital, is more the cognitive and situational individual factors of specific learning disabilities, because those are the things that help medical professionals recognize learning challenges in their appointments. But I also wanted to highlight quickly another more behavioral way of identifying specific learning disabilities that works especially well in the school system. And this is something some people may have heard of, that some people may have not. It's called a response to intervention model of specific learning disability. And this is instead of trying to identify cognitive deficits related to learning before we intervene, the idea is instead, it's based on more of a public health model of set up tiers of intervention that are meant to ensure that all people learn effectively, and use the process of identifying, use the process of providing good, solid, evidence-based teaching strategies, identify who is having some of those learning challenges. So this pyramid here helps reflect the response intervention model, and it's something that's done in 3 tiers. The first tier is students at the same grade level are all receive access to a good evidence-based general curriculum of learning. And the idea is that 80% of kids are going to do just fine with that general evidence-based learning curriculum. But then also about 20% of kids will likely need a more targeted intervention. So the children who aren't learning at a good rate based on those tier 1 general curriculum receive tier 2 interventions. So students who are lagging behind their peers get identified to get added help in those areas. So that could be added reading intervention, added math intervention, adding writing intervention. And so this allows you to target specific skills without assuming too much about the child's overall learning and kind of creating some of these more negative understandings and allowing them to learn at the rate that they are learning at most effectively. And so if 20% of children receive these tier 2 interventions, another 5 to 10, which is, as you guys kind of heard, is where we often hear the rates of specific learning disabilities, do not respond as well to those evidence-based tier 2 interventions. And those are the children who are identified as having a specific learning disability and who need individualized plans that are specifically made to them. So tier 1 is a plan that is kind of given to everyone. Tier 2 are targeted evidence-based interventions that are done in a manualized way, that you do it the way that we know works for most people. And then tier 3 is when we create a plan that's individual to people who then have a specific learning disability. This is a model that works pretty well, especially for reading. It's really nicely evidence-based for reading. It's a little trickier with writing and math, but like any model to identify specific learning disabilities, it's not going to catch everyone. It's not going to work perfectly. And so it's one I think for people working in a medical system, it's good to be aware of. And it's good to know that schools may be doing it. And so they may respond to these challenges differently. But from our perspective in the hospital, since we're seeing children away from that learning environment, it works best for us to help think about some of these cognitive skills and hear about behavioral responses in school to help us identify and think about where learning challenges may come. So let's spend a little bit of time with a quick overview. Again, it's just a start point in talking about specific learning disabilities across the board in reading, written language, and mathematics. And so an SLD, a specific learning disorder with impairment in reading, in the DSM, we talk about this as the diagnosis specific to one of these three areas: word reading accuracy, reading rate or fluency, or reading comprehension. And so a couple things to think of. Some people may have heard the term dyslexia, as well as with math, dyscalculia. Currently in specific learning disability literature, we are referring more to the term specific learning disorder with impairments in reading, as opposed to dyslexia. People still use the term dyslexia a lot because people tend to know that term, but they are interchangeable terms generally. And the second thing I want to talk about is these three areas: word reading accuracy, reading rate or fluency, and reading comprehension, because it highlights the way that we learn these new skills. And it's the cleanest in reading, but it's applicable to almost anything that we're learning as a new skill. And if you look at word reading accuracy, your ability to decode and sound out the words that you're reading; reading rate or fluency, your ability to read what you need fluently across the page, across a paragraph, across a chapter, across a book; and then reading comprehension, your ability to pull information from what you're reading and understand it, utilize it in other contexts, things like that. That is the additive skill development of reading. And there's an underlying course of skill development that works across the board. There's an acquisition of a skill. Anything you're learning, so if you're learning to read, you need to acquire the new skill. You acquire the skill of learning these words, learning how to read across the page, learning how to string the words into a sentence. After you've acquired a skill, you may know how to do something, but you don't know how to do that skill fluently. I can read, but it's very effortful, it's very slow. And when it's effortful and slow, you're using all of your cognitive energy on that reading skill itself. You're sounding out your word reading accuracy. You're sounding out each sound, and that takes a longer time. So if you can't read fluently, it's harder to then apply that skill. And so comprehension, that absorbing, that understanding of what you're reading, is not going to work if you can't read the words accurately, obviously, but also if you can't read the words fluently. Because as most of us do when we're reading, we're not sounding out every sound because that skill has become automatized. It's automatically done in our mind, and we can do it without having to break it down and read it phonetically. Now, some words, when I'm reading a medical journal and there's words I'm not familiar with, I'm going to have to sound that word out if I'm reading it out loud. But when I'm reading words like comprehension, I can read it and I can see it without having to sound it out. So this is important, especially with reading, but with any skill or hearing, because these skills are additive. And so you're not going to be able to, a lot of times this happens with older children. If you're 14, 15, 16 years old and you're having trouble reading, they won't say that you have difficulty with word reading accuracy. a lot of people will jump right to, oh, they're having reading comprehension issues. And they'll maybe try reading comprehension strategy, intervention strategies. But if you haven't acquired those foundational skills, you aren't, and you can't read fluently, which a lot of times for kids these age, they can read reasonably well, but they can't read fluently. You're not going to be able to comprehend what you're reading. So I just wanted to break that down a little bit, because that idea of skill acquisition, skill fluency, and then skill application goes across all specific learning disabilities as well as learning in general. So this is a great visual. I did not make it. You see the source there, and it's been one that's been around for a while. And it's a really great one that highlights the idea of all the skills that go into a specific skill like reading. And this is one, I'm happy to share these slides, and I'll pass them along to Juan along the way, Dr. Lozano along the way. And so anyone can take more of a look at this, because we won't have time to get into all the details here. But just to highlight, when we think about reading, there's the recognition side of reading. That's what we were saying there before. Phonological awareness, the ability to attach the sounds of letters with the symbols. Decoding, the ability to go across a set of those symbols and switch them into the sound words. And then sight recognition. Once you've done that, you can then read those words without having to do the active decoding. And you see in the middle here, I don't know if you guys can see my little thing there, this increasingly automatic thing. So you see these braids of the rope get tied together. And as you practice that, it becomes an automatized skill in your brain. Now, on top here, you have the language comprehension side, because as we're reading, as you guys are all reading the words on this slide, you're also comprehending it. And the skills that go into language comprehension, the background skills, are your background knowledge of the world, facts, concepts, etc. Most of us on here, if we were reading a journal article that was in medicine, we'd probably be able to read it more fluently and comprehend it more quickly than if we were reading an article in theoretical physics, because our background knowledge base is stronger there. Our vocabulary, the words that we know already, is stronger there. Language structure, syntax, semantics are all built up in there. Our general verbal reasoning skills. Some of us are more quick and effective at kind of putting things to verbal language together, drawing inferences, creating metaphors, things like that. And then literacy knowledge, your understanding of genres, your understanding of concepts, your understanding of devices. Again, some of us may do better reading academic journals because we know the conventions of academic journals better than, fine literature, because we're less aware of those conventions. And so just like the braids of the rope of word recognition tied together at the top, these braids, as you can increase your strategic awareness of understanding, are all braided together to form skilled reading. And this is all just, again, on our level to look at all the little things that go into reading. And each one of these things are things that could be individually targeted and intervened on to help individuals who are struggling. Now, as a general physician, or unless you're a physician who's very specifically interested, or a medical provider very specifically interested in reading, you're not going to need to have a fluent understanding of all these skills. But it's to recognize that there are a number of kind of technical reading skills, as I think of the recognition skills, as well as comprehension skills that go into reading. You can start to hear a little more where a child's reading difficulties may be coming from. And similarly here, I like this slide. And again, you guys, I'm happy to pass these slides along so you can take more of a look at it. These are all things that play into, and you see here the older term dyslexia, which is perfectly fine. All of these different difficulties, both at the kind of foundational level of listening, spelling, reading, motor control, are all things that a person with these specific learning disabilities may be having difficulties with. And all these kind of more distal properties, understanding of the alphabet, understanding of sequences, difficulties copying, I'm just kind of reading different ones, These all may be little factors that are leading to how well or not well someone is reading. And so it's not simply as simple as, how many minutes they read every evening, although that's a very big and important thing. We also want to just have an awareness, even if we're not taking note of every one of these things, that there are a number of factors that go into a difficulty like this that we want to be aware of. So next, real quick, talking about specific learning disabilities in written expression. So similar setup as you can kind of see here, spelling accuracy, grammar and punctuation accuracy, clarity and organization of written expression. So the accuracy or the skill of writing and spelling, as well as grammar, and then also ultimately that application piece, the clarity of written expression there. And just a note there, when we're thinking of a specific learning disability in written expression, we're not simply thinking of poor handwriting. If it's just poor handwriting, you wouldn't say that I have a specific learning disability in written expression because I have really bad handwriting, which I do. In that case, we want to think about a developmental coordination disorder because we want to think of the motor side of that, of the writing generation as a different difficulty, but related to the specific difficulty of the output of what you are writing. Again, thinking of these braided strands that go in, I'm going to go through this relatively quickly because I want to make sure we have time for discussion at the end. These strands that go into skilled writing, critical thinking, the ability to generate ideas, the ability to organize and process ideas and things that you're thinking of when you're writing, the syntax, the grammar and syntactic awareness, the ability to elaborate sentences, the ability to punctuate appropriately and accurately, the structure of the text, the narrative, informational, opinion structures, the structure of paragraphs, the pattern and organizations, and the linking. I think all of us, when we were thinking of, writing entrance essays or writing essays through secondary school, we had to think not just of the paragraphs we're trying to write, but how we link our ideas from one area to another. We can also think of the craft of writing, our word choices, our awareness of task, audience purpose. A lot of us who do scientific writing, we think a lot about the message we're trying to get across and who is taking in what we're reading and how that may work. And for those of us who work on a more literary level, we may be thinking about literary devices and the way we use metaphors and the way we paint a picture of what is written. And then the technical transcription, and this is where the developmental coordination difficulties can interact with specific learning disabilities and written expression. This was the spelling as well as the handwriting and keyboarding. But again, we want to think about, and again, the classification of this is less important than the skills themselves, right? To think about whether this is a specific learning disability, written expression, or this is a developmental coordination disorder, or if it's both. That's important. And teasing apart those difficulties are important. But also at the end of the day, we want to think about a skill that a child's trying to learn, and we want to think about how best to teach them that. The reason why we want to separate developmental coordination disorder is that there may be other fine motor delays that could be worked on outside of writing, through occupational therapy and other strengthening of those fine motor skills that could ameliorate the difficulty without some of the other academic interventions. But oftentimes it's both, because if you have more trouble with the motor side of things, over time, you have less exposure or practice to writing. And no one, as all of us who do a lot of writing, we know that you don't just start as a great writer. A great writer takes a lot of practice over time. So as we keep going, another kind of big picture thing like this, dysgraphia, again, a previous term that we use more frequently, still perfectly reasonable to use if you want to, for specific learning disorder and written expression. You see all these skills that are related to that difficulty of someone saying, hey, this kid has trouble writing. And so we also want to talk about specific learning disabilities in mathematics. And these are the areas diagnostically where you can do a specific learning disability with impairment in mathematics specific to number sense. That's always a funny one because that doesn't feel, it's one of those things you kind of feel, where phrases you feel like you understand and don't understand at the same time. Number sense is the ability to recognize how numbers work. And this is at a very fundamental level, right? So, an example of this is you can often see young children who can count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, but they don't have one-to-one, what we call one-to-one correspondence of counting. So they can't recognize that that same thing you did, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, were, is there to represent these 10 things. So if you give them 10 blocks, they don't recognize that that counting is the same as counting each individual block, and that one of those numbers represents a quantity of those blocks. So that's an example of number sense. So again, skill, you hear their skill acquisition, right? Learning the underlying concepts. Memorization of arithmetic facts, accurate or fluent calculation. So you hear number sense, memorization of facts. Those are acquisition tasks. Accurate and fluent calculation, those are fluency tasks. And then accurate math reasoning, that's the application of those skills that you're using. And here are some of the grades that go into an understanding of specific learning disability in math and mathematics. You'll see your conceptual understanding of skills, your ability to understand the underlying math concepts. Procedural fluency, this is where I struggled with in algebra, was I could understand all the concepts, but when I had all the equations out there and I was moving along the algebra, my procedure, I would always make an error. I'd make a transcription error somewhere, and I would have difficulties there. So you have difficulty in the procedures of computing the application that you're trying to do. You have difficulties in strategic competence, pardon me, or applying the skill, understanding the concept, knowing how to compute it, applying it to situations. There's adaptive reasoning, the logical understandings and explanations, transporting the concepts to different areas. And then the productive disposition, your willingness to kind of engage with the math concepts. I think any of us who aren't big math people can recognize that sometimes a part of understanding math is the willingness to kind of hang in there with it and understand the concepts. And specific learning disabilities in math can be more diverse. Reading, as complex as reading is one main skill with many applications. When you really break math down and you think of things from arithmetic to algebra to geometry to calculus to beyond, a lot of them are additive, but a lot of them are different conceptual skills as well. Now, I was a strong geometry guy and I wasn't a great algebra guy. And I can't explain to you exactly why I was, but I think it kind of made sense. And I think there are different cognitive skills and cognitive dispositions that make some math concepts and some math skills easier, some math concepts and some math skills harder, as well as your exposure to instructions and all those things. So I always want to say you'll hear people when they're talking about SLDs, math gets a lot more muddy and a lot less clear. You're probably already hearing me hit on that in my talking about it. But that's because math is a nuanced and it's many different types of skills. Same thing, feel free to take a look at this down the line here. There are diagnostic specifiers. Again, you can read through some of those. It's basically all you're going to need to know is if someone has a mild, moderate, or severe level of the specific learning disability. You can see in here, those are operationalized. For the sake of time, I want to make sure we get some good time for questions. So I'm going to just let you know that those exist, and you can feel free to look into those further as you're interested along the slides, or feel free to reach out to me if you have more questions. A couple of tools and strategies just to kind of highlight and look at. This is one that I want to hit on and identify here, is that there's a developmental course of learning disabilities, and they can look different at different times. And this is one, if I was specifically a pediatrician, and I was doing a lot of just check-ins with kids and families. I would be looking at these quite a bit. Feel free to take a screenshot of them. Feel free to again look at the slides later on. What you'll see through here is a lot of avoiding different kinds of tasks at different ages, and then different levels of the types of difficulties they see. So preschoolers, when you think of preschool, what's going to predict types of learning difficulties is language delays, difficulties with kind of learning things like nursery rhymes, baby talk, things like that, trouble learning and remembering letters, and having difficulty learning to count for kind of math skills. Through kindergarten, one of the things, especially for reading, that I highlight is the ability to rhyme and the ability to split out words into component syllables. So some of our tests, you'll see ones like you see here, cowboy. How do you say cowboy without the cow? And this highlights what we call phonemic awareness, the ability for the child to identify the different sounds within a word, and that predicts learning difficulty. So if you have a child who couldn't do that at 6 or 7, you may want to wonder if they're having difficulties with reading. Also, if they have trouble writing their name around the kindergarten age, and again, any kind of school avoidance, you're always going to be thinking about it. On through elementary school, if you have a lot of slow or inaccurate reading, a lot of difficulty understanding spoken or written numbers, difficulties attaining and remembering math facts. First through third grade, there's a lot of memorization and learning there. So if you're not memorizing and learning, kind of picking up those math facts. If you're in second grade, if you go, hey, what's 2 plus 2? And they have a long pause, that's where we may have some things to be thinking about. So through kind of 4th through 6th grade, or the elementary school years, or kind of early, kind of mid-primary school years, mispronouncing multiple syllable words or just kind of guessing at them. You see photosynthesis and they just say photograph because they're not able to sound out the specific sounds. So they just kind of pick a word that's similar that they do know that it sort of looks like. Longer time with completing assignments. And honestly, elementary through adolescence, the biggest thing I would listen for as a physician is work refusal and work avoidance. Now, especially through adolescence, we know work avoidance is pretty common, but if you hear it, work refusal, work avoidance, and the third one, I should have said it first, is taking way longer to complete tasks than you'd expect. What we often hear from parents is they give us 20 minutes of homework and we're doing it for 3 hours. That's what it may sound like in 1st through 3rd grade, but if that isn't resolved through 4th to 6th on through adolescence, that may resolve with just refusing to do homework or not doing it or not reading the book you're supposed to read in high school. When you're hearing those things, you always want to wonder all the other reasons why a 15-year-old may be avoiding work. But you also want to wonder, hey, how strong is his reading? And whether that's you do some informal assessment in the moment, or this could be a time where you refer on to psychologists who focus on psychoeducational assessment or others. Those may be times where you want to investigate some of these things further. So I'm going to jump through a couple things to make sure that we have some more time to chat. From our side in the psychoeducational assessment, what we often do is we often do intelligence tests or other cognitive assessments. And we also do achievement tests to look at academic achievement. And so one thing when you're hearing IQ tests versus achievement tests or other cognitive tests or neurocognitive tests versus achievement tests, what we're trying to highlight is what someone can do or their capacity for a skill versus the achievement is what they are doing. Your IQ suggests how well we'd expect you to do in school. An achievement test like a Wyatt would test how good you are at actually reading words. So looking at those differences between can do and what you are doing is the foundation, again, there's a lot more nuance that we could get into at another time, of how we identify specific learning disabilities. Again, we talked about a lot of this along the way, things that we can be listening for, consistently misidentifying visual or verbal sound characteristics of letters. Another thing, just because we talked a lot about on the one end, you're having comprehension issues and haven't learned the foundational skills. Just because you've learned some of the foundational skills, you're reading things really well, but once we ask you about it, you really struggle with, there are differences in the sole comprehension skill. This happens a lot with our autistic kids that do a really good job at rote learning, but have more trouble with application of skills, with comprehension and consolidating, organizing of information. This is where a lot of those executive functioning challenges can particularly come in. Some of the concreteness of autism, some of the executive functioning challenges of something like ADHD. Those are things you may be hearing about. They read great, but they can't comprehend anything. For specific learning disabilities, written expression, we often may think of, they can't get it out of their head and onto the paper. You hear a lot of that. Like, I know I'm supposed to say something, but I don't really know what to say. So there'll be a couple of these things on there, but I do want to, like I said, feel free. I'm happy to share the slides and let everyone kind of see those things. But I do want to make sure I pause here to make sure we give you guys 10 minutes for questions or other things like that, and kind of go from there. So.
Yeah, thank you very much, Chess. I think you highlighted a lot of the most important points of understanding what are the specific learning disabilities, and also just highlighting the role that just the primary care physician, a pediatrician, has on, as you were ending here, on identifying. And even though they're not in charge of the diagnosis, just making sure that they can guide the family towards what are the next steps. So one of the questions here is if a family is noticing that there's some difficulties. I know you placed the table there, but again, there's a question is, how early can a child be evaluated for dyslexia or basic on reading?
Yeah, absolutely. That's a really great question. And so I think these skills are always on a continuum, and I'm really bad at giving like this exact answer because as you guys probably heard, I like to think about things broadly. But what I would say is you can, by 5 or 6, you can definitely, absolutely start looking at specific learning disability. Now, that may not be something that we diagnose right at that moment, but we absolutely can start. The biggest thing with a specific learning disability is you need to be able to separate out the capacity skills versus the achievement skills, right? And before 5 or 6, there really aren't too many of those. Though if by 4 they don't know any words, any letters, or if they don't know any numbers around 4, you may have trouble. But by 5 or 6, for sure, if they don't know their numbers or letters, if they're starting to, 6 or 7, not have some of those rhyming skills, some of those sound segmentation skills, they're not starting to read words, you certainly could either highlight for the school that they may want to check on that. Now, the school should be monitoring these things. They should be, from the get-go, screening for these skills. But if they're not, you can also refer to people like myself, psychologists who work in psychoeducational assessment, and can help characterize these things. One, to highlight if we can say, yeah, there is this SLD, let's work on it. But also, two, we can also create a baseline of functioning so that we can see how those rates of learning are changing over time. So I'd say 5 or 6, you can start.
5 or 6, we can start looking into more specifically and evaluating. And the same question goes here is towards the end. So while we can see a lot of a continuum, like a spectrum on all of this and how it presents, is there an age range where, well, we never say it's too late, but it's like the gap that we've acquire around this time is like it's going to be challenging.
Yeah, that's another great question. And I think you always want to be careful with that question. Because, like I said, one of the issues with SLDs we've always had is this idea of kind of like a self-fulfilling prophecy, right? That you kind of assume someone isn't going to do something and then you don't try as hard as you could and then they don't do it. And you say, you see, I was right. But we also know that there are sensitive periods in learning and we know how the brain develops. So what I would start to say is for foundational reading skills and for foundational cognitive skills, we know a lot of our skills start to slow between 9 and 12. And so by 12, 13, if you haven't had some of those foundational skills um, established, it's probably going to be a lot harder than it was earlier on, which is why it's important to start early. And also, while we may want to shift our thinking a little bit, if we're not reading at all by 13, 14, it may be less thinking about how we can appreciate the great authors of the world and making sure that we can read a menu, that we can read your schedule on your phone, right? That you can do functional reading, that you can make sure that you're getting what you need there. And then I think for more of the comprehension side, you know, comprehension skills keep developing for most of us, through adolescence. I would say between 22 to 25 for some of those more high-end skills that, they get. Most of us have probably felt that it's harder to learn some of those as we're getting into our mid 20s to 40s. So for those skills, I would definitely think we can still build on them, but they get more and more concrete the older you get.
Right. Right. And there's here another question. It's a long one, but I'm summarizing it.
Yeah, sure.
Pretty much, you were saying like a child who shows externalizing behaviors, defiant, not wanting to work, just disruptive behaviors in general. Yes, we need to evaluate, but the just trying seeing this as a presentation, probably this is something different, but as a presentation of a gifted child or a higher IQ or just doing way better than their peers. The question is it this the same process of evaluation or is something different though?
Yeah, so I think it depends a little bit, and yeah, so in general, yes, yeah, the same process of evaluation would be similar. Now, it always varies once you know things, right? So if you know someone has a very high IQ, one thing, just because you have a high IQ doesn't mean you have a high IQ at everything. I sound a lot smarter talking about psychology stuff than I would if I was talking about calculus. I wouldn't sound too smart. And so just because you're good at one thing doesn't mean you couldn't have a deficit in another area. And especially on the behavior side, you may feel really smart at things, and then if you're not great at math and you're used to being able to talking laps around everybody, that may be an area where you have some difficulty and you may act out there. So yeah, overall the process is the same, especially when things are happening only at school. I would always think about, is the instruction at a reasonable level for this individual? Because most of us get ornery, we get inattentive, we get sad, we get mad when we're asked to do something that we don't feel comfortable approaching. And so that's how I would generally think about that.
Great, great. And so Chaz, we're a minute before nine. So
Yeah.
it worked out perfectly. So thank you very much. It was just a great lecture and a great discussion that we were able to have with you. And a great way just for you to know that for us to end up our academic year for this. So thank you very much, Chaz.
Yeah, thank you all, please. I'm happy to talk with anyone. My Spanish is not very good, but I'm happy to answer any questions or correspond over email if anyone would like to chat further on any topic.
Thank you, Chaz.
And thank you all so much for the opportunity.
Thank you.
Thank you, doctor. Thanks for being here. So, les recordamos que el día de hoy fue nuestra última sesión del año. Nos vemos el próximo año en enero con nuestro bloque de dermatología. Muchas gracias a todos. Thanks, doctor. Have a nice day.